Hey, it's Dr. Braddock here from Braddock Chiropractic. On this video, ADD, ADHD. Alright, I believe that's something that everyone is familiar with, terms that we're familiar with, but that's attention deficit disorder, attention hyperactivity disorder. And what we're going to talk about in this video is kind of a different viewpoint to maybe look at this, or maybe just a little bit further explanation. So if this is something you're dealing with in your family, or you know people who are dealing with this, maybe it could offer just a little bit of insight that you might not get otherwise. Alright? So one thing that we see that I'll see across the board that, and literally I'm going to take about an hour's lecture that I've done on this, and I'm going to squeeze it into just like 3 or 4 minutes. So I'm going to give you kind of the Cliff Notes version. But one thing I think that we're just not going to use and talk about in this video are the drugs used to treat those. We know those are Schedule II controlled substances. They're literally separated from things like methamphetamine and cocaine by a comma. And to be Schedule II, that means that they are known to cause addiction and that they have to be kept under a lock and key. So not to say that maybe those drugs aren't ever necessary in some cases, but I think most people watching this video would agree that if we could avoid them, our children would probably be safer for that. So let's talk about what ADD is, ADHD is, and then we'll talk about maybe a couple of different viewpoints in terms of treating that if this is something you're dealing with in your family. One, this is a neurologic condition, alright? We know that it's affecting the nervous system, and the nervous system is how you experience and respond to the environment that you're placed in. Your nervous system is your master system. As a chiropractor, that's something you hear me talk about over and over and over. Whether it's your endocrine system, your immune system, circulatory system, digestive system, all of those systems work solely because the nervous system tells them to do that. Okay, and that basically, for review purposes, the nervous system's the brain, the spinal cord, which is the brain's tail, basically, and then all the nerves that go off to every cell, organ, and tissue from that spinal cord, and that's your nervous system. So what you can imagine is children who are under this disorder, ADD, ADHD. A couple of different things that we can talk about. Well, one of the biggest things that we see in our office is that those children are suffering from spinal subluxation. And that simply means that somewhere in their spine, bones have become misaligned, and it's starting to put pressure and irritate that nervous system, be it the spinal cord or the spinal nerve roots as they exit. And basically what happens there is it starts to put static in that system. You can imagine that if you were trying to get directions from someone over your cell phone and you had a poor signal, there's static. What do you do when you have static? I mean, in my house, I get really poor reception. I'm always walking around. Can you hear me now? Can you hear me now? Can you hear me now? I'm constantly moving, trying to get a signal, a cell phone signal in my house. Well, when your child has that spinal subluxation, it's putting pressure on their nervous system. They have static in their system, right? And so that's the easiest way to explain it. And one of the easiest ways for them to find relief is from neurologic stimulation. One of the easiest ways to do that is movement. All right, when you're moving your body, those joints are acting, and not to get too much into neurology, but it releases something very cool called the mechanoreceptor. And what those mechanoreceptors do is they calm the nervous system. So one of the things I find, especially in patients who've come to our office with help with this, is they are typically some of the smarter or more intelligent kids in their class. So we're never dealing with a disability in terms of intelligence. These are most likely the more intelligent kids. And believe it or not, even though they may be flitting around the classroom or you don't feel like they're giving you much attention or focus, they're usually picking up so much information they're almost bored at that point. But the movement is what allows that child to find a little bit of relaxation and calms their system. Whether they know what they're doing or not, that's typically the reason. The second thing that I'll have parents say, usually if I'm doing a long lecture on this, the parent will raise their hand and they'll say, well, what about my kid? My kid's different, right? They can't focus, they can't pay attention, but you set them down for a video game and they can sit motionless for 8 hours. So what's the deal there? The deal there is that in that video game, and I don't play a lot of video games, but when you play a video game, there's, Martians or whatever is going on in there. I'm going to date myself, talk about Super Mario, but there's so many different things happening on the screen that you have extreme neurologic input, right? It's super interactive, and you're having to respond. So your brain, even though you might not be moving your body, your brain is under extreme motion. and they find that calming. That's why we see a lot of kids who suffer from that condition really almost find video games therapeutic. And for a lot of parents, it drives them crazy. Why can't my kid pay attention when I'm trying to talk to them, but they can pay attention to video games? So that's kind of what we're dealing with neurologically. A couple of ways we address this. Well, we can just talk across the board. One is the medication. I'm not going to go too far into that. I don't want to get into something controversial, but most of the people who come to our office are people who maybe have tried that. A lot of times they even get, the children coming in and say, I don't like the way this medication makes me feel. So if that's not working for you, you're looking for a different avenue possibly. The two other aspects are chiropractic care. And you may be watching this video if you're not currently a patient of mine. You found this on Facebook or YouTube and thinking, why on earth? What does chiropractic have to do with ADD, ADHD? I thought that was back pain. I thought that was neck pain. I thought that was if you were in a car wreck, right? And that's not necessarily the case whatsoever, especially with the type of care that we do in our office. What we find is that once we start adjusting those children, we're relieving that nerve pressure, and we're actually letting we're giving their system relief, nervous relief. So the same thing is true whether it comes to a child who's maybe had a sports injury, maybe a birth trauma. It might be something you don't even know about, but once we determine if there are subluxations or misalignments that are causing that interference in the nervous system and we relieve those, we see dynamic changes in those children. And the nice part is it's totally natural. The second thing that we always address, especially in our office, along with the nervous system aspect or the subluxation aspect, is the nutrition aspect. A couple things that we can do. One, to change maybe what the child's eating. Obviously, we want to limit sugar. We want to reduce carbs. We want to increase protein. A couple specifics, we could talk about that on a one-on-one basis. And then a couple of nutrients that we need to make sure that we nourish that body with, even beyond diet. One of those is omega-3, quite possibly one of the most important nutrients any of us can get as an American. So again, that might be something to consider, whether it's with me or any other healthcare professional, to determine whether that might be right for you or for your child. We've had fantastic results with this in our office. One thing that just really breaks my heart is most parents come in and they feel like almost at the end of the rope. Like, well, maybe they don't want to do that traditional route, but at the same time, their family dynamic still has to function. They have to do something. They have to have some sort of relief. And so I think it's just a total blessing that for a lot of those people, we can be an outlet for that. If you're interested more in maybe what chiropractic can do, welcome you to call our office. The girls would be happy to schedule you an appointment. We could sit down and go over how that could affect maybe your son or daughter, and if chiropractic care would be a logical avenue for them to take, or for you guys to take as a family. We see more kids and more families in our office every week. That's what we love. That's what we're passionate about. We know that if there is a maximized nervous system, that you are going to have a maximized life. You're literally going to be able to live life abundantly. That's what we desire for each and every one of our patients. I hope this video was helpful, at least to some degree. If you have any questions, like I say, call our office. I thank you for taking the time to spend a few minutes with me here on this video, and I look forward to seeing you soon. God bless.